I'm Peter Block in Orlando at the AHA annual meeting for On the Scene, and with me is Deepak Bhatt, a man who has done a lot of these wrap-ups with me, and it is day 3, and we're looking at the clinical trials that were off embargo today. So, Deepak, we have 2 trials we want to talk about, PROACT 4 and Pegasus Timmy 54. Right. So let's talk about PROACT 4 to begin with.
Yeah, so basically this was moving troponin upstream, that is troponin measurement upstream in the ambulance to see if that could shave off the overall time that a patient's spending in the ED before disposition's reached, and in fact it did shave off some time.
Well, I think it's a peek into the future, Deepak. If you think about 2025, what are we going to be doing with infarcts? And my guess is we're going to be doing a lot more on the street in the ambulance before patients get to the ER. 10% of those patients that were studied actually had positive troponin. Now, if they have ST elevation, you're probably going to take them to the lab anyway. If they don't have ST elevation, maybe you will, maybe you won't. But it may save some ER time and at least gives the docs taking care of these patients a heads up that there is something going on in the heart. Now, the myocarditis patient, of course, is always a problem.
Sure, but on the other hand, you're going to get that troponin anyway in the ED. Yeah. I don't see any immediate downside to moving that upstream.
Yeah, nor do I. So we'll keep an eye on how things evolve as far as in-ambulance care is concerned. Now let's move on to Timmy 54. Right. That's your purview, so Timmy 54 is right in your hip pocket.
Yeah, Pegasus Timmy 54. So the main trial results, of course, have been published and presented already, and in fact now ticagrelor 60 milligrams twice a day is FDA approved for that patient who's post-MI after 12 months. But what this particular analysis demonstrated was the tolerability, comparing the 90 and the 60 milligram doses, and it turns out the 60 milligram twice a day dose is a bit better tolerated than the 90 BID, so better adherence, less bleeding as well. So overall, in terms of the chronic patient, we're not talking about ACS where 90 milligrams BID is still the guideline and FDA indicated dose of ticagrelor for that first year. But after that first 12-month period, it looks like 60 milligrams twice a day is the dose to go with if the physician elects to continue beyond that 12 months.
I agree. Now, one of the things we have to remember is why not ask the dumb question, and I did ask this when I was doing another interview, why not just switch over to aspirin and clopidogrel? And, the studies have shown that ticagrelor is, in fact, better than clopidogrel in ACS. So, probably this study makes some sense.
Sure. So first of all, there are no dumb questions from you. They're all good questions. Well. It's actually a very intelligent question. So for the patient who's already on ticagrelor 90 BID for a year, because of an ACS, has tolerated it well, no bleeding problems, it makes sense then, based on the Pegasus data, to continue, but at 60 milligrams twice a day. But I would say, likewise for that patient, there are a lot of them out there that are high ischemic risk, low bleeding risk, that have been on clopidogrel because they've had an MI in the past, and now they're, post 12 months. I don't know that I'd switch that patient to ticagrelor 60.
I totally
think
agree with you.
Keep doing what I was doing, assuming that the patient is doing well.
Yeah. So there you have it, 2 trials for today, a wrap up for day 3. Thank you.
Absolutely.